Hello all, this is Dr. Dheeraj Masapu. Welcome to my channel. And today we have my friend and consultant neurosurgeon, Dr. Abhinash Datta. Abhinash, welcome to my channel.
Hi Dheeraj, hello everybody. I am a very ardent follower of Dheeraj's YouTube channel. He's doing some really good work, and since he requested me to react to a video, I thought why not give it a go.
Thank you Abhinash for coming into my channel. My subscribers will be very happy for that. So today what we are requesting Abhinash to do is, I want him to react to a very famous scene from the movie Doctor Strange, and it is a scene where Doctor Strange operates on a bullet which is there in a brainstem. Very difficult to operate.
Doctor Strange, actually Doctor Strange is the reason why I became a neurosurgeon. When I saw Doctor Strange, I was so inspired that I thought, why not become a neurosurgeon? And yeah, I was kidding.
So let's go into the scene. Abhinash, you have to do like this. No, you're doing like that. I'll show you. So we'll be reacting to the scene now. Let's start the scene.
Okay. Yeah, that's a very familiar scene for me. Scrubbing in. Okay, nice, very good, but here what my confusion is, why he had to put on the mask after he scrubbed in. That is really weird. The mask you have to wear the moment you walk into the OT. Once you scrub in, you are not supposed to touch anything else except the field where you are operating in. So that is like really strange.
So first you need,
I'm sorry Dr. Strange, but that is really strange.
He doesn't mind, don't worry. So first you need to wear your mask and then your gloves. That is what you're telling me.
Absolutely.
Yeah, that in COVID times it is even more important to wear your mask all the time.
Yeah. Okay, that is good. Yeah, they are setting up the table. Okay, he has dived right in. Yeah, that's nice. That's groovy. I like this. What he's doing here is playing music and operating. To be very honest, that is something that I do every single day, day in and day out. Music really helps me concentrate in my surgeries, and yeah, it gives everybody a nice vibe, and we do such high tension surgeries.
I have a question for you. Do every surgeon listen to music, or only some surgeons listen?
Not really, not really. Some people like absolute quiet in the OT. Not even, I mean, like even very small and minute sounds can distract them. But I'm not that kind of surgeon. I really want nice music. It can be rock, it can be anything, but it should be nice music, and it really helps me concentrate in my work. And yeah, I mean, that's the general vibe in our OT.
Yeah, superb.
Yeah.
Let's
so
go.
this part I definitely like. Thumbs up, Dr. Strange. Yeah, that's really good.
Billy. Feels so good. Chuck Mangione, 1977.
Any comments about?
Oh my God! This is nice. This is something that I do day in and day out. Actually, these people even make fun of me, saying that I know all the songs and all the singers, all the history. So I just want to see what he says about this song, and then we can just get back.
It'll be hard.
It's 1978.
No, Billy. Well, Feels So Good made it charted in 1978. The album was released in December of 1977.
No, Wikipedia says.
Nice.
Where do you store all this useless information?
Useless. The man charted a top 10 hit with a flugelhorn. Status, Billy?
Absolutely. So this is something, to be very honest, that I experience almost on a regular basis. Whenever I comment on songs and singers and albums, and when it came out, when it got released, whether it was a hit, it was a flop, which was the other chart buster in that year, then people are like, from where do you get all this information and how do you store it? How do you process it? I mean, everybody has the general concept that if you are into a highly competitive field like neurosurgery, neuroanesthesia or whatever, I mean any medical profession for that matter, they think that it's quite strange to have so much of knowledge in another sphere like music. But for me, it was always my passion, and I was always into music. And yeah, I really enjoy even the facts about music. I definitely enjoy the music per se, but even the facts about music, the singers, the albums and everything else, it just excites me so much, and that's really something I dig. I totally dig this.
And,
Great job, Dr.
here
Singh.
I would like to tell something. You please subscribe to Dr. Avinash Datta's channel. Link is in the subscription, and he has a channel where he plays different types of songs. I heard them. It is absolutely wonderful. Okay, the link is in the subscription. Don't forget. Let's go back into the scene. Pyong.
Please, I hate you.
Oh, feels so good, doesn't it?
That's pretty cocky. That's pretty much like me.
Oh, I forgot to see. You've done your big. Go ahead, look closer.
What is it?
GSW.
Amazing, kept him alive. Apnea for the brainstem test and the apnea reflex test. I think I found the problem, Dr. Palmer. Left a bullet in his head.
Thanks. It's impinging on the medulla. I needed a specialist. Nick diagnosed brain death.
Okay, so first of all, it's a very strange X-ray that we just saw. There was a bullet in such an angle that I am not able to comprehend how the patient was shot, and the place that it has lodged. It is like one of the rarest place in the entire human body where a bullet can be lodged.
It needs to go some.
It's heading this way, so I think he was shot like this, and because of I don't know what reason, it stopped there. A very bad bullet. So
What scanning is that? Can you?
yeah, the scanning, see the X-ray, I agree, an X-ray can be done, but she said that the bullet is impinging on the medulla. So the medulla is nothing but a part of the brain stem. And if I'm not wrong, I could see some MRI images that he was going through in his fancy tab.
Yeah, MRI images are there.
So the best way to kill a patient with bullet injury is to do an MRI. Especially if it's in the brain stem and you do an MRI, you can be sure that he will die.
Why?
Because
Any reason is?
you're not supposed to do an MRI with any metal in your body.
Oh, point to be noted.
It's
A slightest move in that area is very lethal.
yeah,
That is what
it's a bullet for crying out loud. So if you are an epic loser with the IQ somewhere between 70 to 60, then you will do it.
Then they have done this.
Yeah, let's see what happens.
That doesn't feel right to me.
You have to run.
Dr. West, what are you doing? Hey,
Organ harvest. He's a donor.
slow down. I did not agree to that.
I don't need you to. We've already called brain dead.
Prematurely. We need to get it prepped for suboccipital craniotomy.
Not gonna let you operate on a dead man.
What do you see?
A bullet?
A perfect bullet.
Okay, so here I would like to ask Dr. Dheeraj a question. He said that the patient is already taken up for organ donation, right?
No. See,
He has already declared brain death. So there is, both of us are aware of the criteria of
Yeah.
brain death. And he has said that he has already declared brain death and also put up for organ donation.
there is a specific criteria for brain death, and it's a team who should decide whether the patient is brain dead or not. There and a series of tests like apnea test, brainstem reflexes to be tested, and all the blood levels of all the toxic metabolites to be checked, and the test to be done at an interval of 6 hours, and 2 to 3 series of tests are required over a period of 24 to 48 hours to confirm that a patient is brain dead. They just confirmed of brain death.
and
one
put
person-
up for organ donation.
And put up for organ donation as if it is so simple. And there is a brain death certification team.
Absolutely.
Certified team is there, and there is a separate organization which approves those clinicians. Usually a neurologist, neurosurgeon, neuroanesthetist are usually certified in that board. So that is about the brain death.
Let's see now what happens. Let's see how much absurd it can get.
Central nervous system shut down.
You gotta go.
Patient's not dead, but he is dying. Still want to harvest his organs.
I'll assist you.
No, Dr. Palmer will assist me.
Cool.
Is that
That's a craniotome.
Oh.
That's a craniotome, the thing that we cut the bone with.
So correct instruments only they are using.
Yeah, the instrument is correct. That looks like a Medtronic drill set, an electric drill it is.
Okay.
That all is okay. Now the absurdity starts. Yeah, this is very, very absurd. Your thoughts, Dr. Dheeraj? What is absurd about this?
I think
He is not wearing masks.
Oh no! Why
They're
didn't-
not wearing masks. Brain is the most sterile organ in the entire human body.
So what will happen? Can you tell our subscribers if you don't know?
What will happen is most likely, and not to mention even, I mean, like most of her hair was out. I don't know what cap she was wearing.
Some dandruff and all.
Yeah. So it is absolutely absurd to go for any surgery, especially brain surgery, without wearing a mask. You expose the patient's brain to any kind of infection. You might cough into it, you might sweat into it, and it will lead to something called meningitis or encephalitis, and that's end of story for the patient. And if such an event actually occurs, then you might kiss your career goodbye.
Got it.
So
Thank
let's
you.
see.
Let's go into the scene.
Image guidance stat.
We don't have time for that.
Can't do it freehand.
Again, I will. This isn't a time for showing off strength.
Put on your masks, people, please. It's a pain to watch this. Okay, that's a C-arm. Okay, now something fancy they are trying to show. If you noticed, he did something like this, and two very fancy looking things came in front of his eyes. Those. So,
What are those? Actually?
those are actually called magnification loops, and believe me, they just look fancy. They're not that fancy. We don't use magnification loops in neurosurgery. They are used by, let's say, plastic surgeons doing some plastic surgery repair or something like that, and even for vein graft harvesting or all they do.
Some other surgeons also use. I've
Yeah,
seen,
in CTVS and all they use.
CTV,
Yes.
cardiac surgeons also use.
Yes,
that.
but they are operating on bigger structures. Here this guy is going to operate near the brainstem, and he's using a magnification loop, which is absurd. What we use, as you also must have seen in the OT,
Microscope.
yes, high-end microscopes. In today's world, we have to use very high-end microscopes, and just because he has put on a loop doesn't mean it's anything fancy, and that too in the US. It's unimaginable. I cannot even comprehend why they are showing a magnification loop for a brainstem surgery. So yeah, let's get on with it. So that's the C-arm.
Is this instrument?
Yeah, this instrument what he is using is actually a disc forceps, okay, that we use to take out the intervertebral discs in disc surgery.
In back surgeries.
Yes. It's called a disc punch or a disc forceps, also known as pituitary forceps.
Oh.
So now what he expects, according to me, we'll find out, is to maybe extract the bullet with that forceps. So let's see how he manages to do that. Okay, wow.
Is it possible to go like that?
No, 1 second. Just to be clear, what he is doing is using a C-arm, and he is following the image guidance. Okay,
yeah.
image guidance. But very weirdly, he is looking through the loop into the brain. What I wonder is, who is looking at the C-arm?
Oh, you need to look at the CM and then go ahead.
Yeah.
Like, you're supposed to.
Someone has to guide him about that. But still, let's see.
Dr. West, cover your watch.
About this, I would like to ask you. Like some surgeons are very sensitive to sound.
Yeah, so see.
Not you, but some surgeons are there who are very sensitive to sound.
No. I agree to this because I am not at all distracted by sounds and all. But there are some people who can, operate with the music on. But these kind of sounds they can find irritating. Even my boss, when he operates, he's okay with soft music playing in the backdrop.
Yeah.
But if someone talks or chats and any random activity happens, then he gets distracted. So yeah, I think he's justified in asking him to silence his watch.
Got it. Let's go into the video.
Okay. Okay. Grab the bullet. Wow.
Wow. Now the bullet is out.
Wow. So what I could make out from the C-arm or the image was that he didn't even grab the bullet. The bullet just came out like a magnet. I don't know what magnetized the forceps. And I really thank God that this is just a movie and it's not meant to be taken seriously.
No, we are trying to educate people.
Yes,
actually,
yes,
that this kind of surgeries are not existing. Don't think that.
It is. It is quite impossible. See, first of all, if you have a brainstem bullet, then 10 times out of 10 you are dead. And I think the first fellow was right in saying that the person was dead. Only he exaggerated it. And this surgery that they showed, it is fit for Marvel superhero movies.
Yeah.
It is not something that we do in our daily practice or whatever. And overall, it was a fun video to watch. But I must say that it's not technically correct at all. But having said that, I am a big fan of Doctor Strange, and it was an enjoyable video. With few of the things they have shown are pretty accurate. But most of it, like I pointed out, maybe I'm being harsh because I myself am a neurosurgeon, but still...
Neurosurgeons are a little harsh, please, not the point.
Yeah, but whatever be it, I enjoyed the video.
So thank you, Dr. Avinash, for coming into the video. My subscribers will be very happy. A neurosurgeon reacting to a neurosurgery scene. So last one question is that what is your advice to students of MBBS or MS general surgery guys who want to take up neurosurgery as a profession and who want to do neurosurgery, basically MCH neurosurgery? What is your one line advice to them?
It's very difficult to give a one-line advice, but if when you ask me this question, I can ask myself why I wanted to become a neurosurgeon. So see, neurosurgery, the term itself is associated with a lot of glamour. You might think that you are like a god with, like workaholics with God complex. But to be very honest, it is a very big grind. You have to work really hard day in and day out. You have to study as much as you operate. And you have to sacrifice a lot throughout it. But if you are really passionate about it, if you really want to help people, if you want to do cool surgeries that can be shown in movies like these, then yeah, it's worth it. You have to work really hard. It's you have to have the the will and desire to go through all the competitive exams. And of course, if you work hard, there is no way why you cannot do it. If I can do it, you can definitely do it.
Thank you very much, Avinash. So well, let's wrap up the session, and thank you subscribers for watching the video till the end, and please subscribe to my channel and click on the bell button, and more doctors are coming in future to react to all kinds of Hollywood movies and all the seasons possible. Only the experts will come and react to the specific scenes. Thank you very much.
Thank you.